have tested positive for the new COVID variant. Now, the government has put them in single room isolations in designated facilities in states. But how much of a concern is this? What is the government doing for surveillance, for contact tracing? And what are the steps the Health Ministry plans to take to tackle this fresh challenge? Mohana Basu, who tracks science as well as health for us, is with me in Government Matters to start sending in your questions. Mona, so of course, this was a fear over the last few days when we learned about this new variant, when flights from the UK were banned. But now that 6 people have tested positive, what is the first step that the government is looking at?
So right now, as you said, that everyone who has returned recently is being tested. All of the samples that are coming out positive at this moment, they are being sequenced to see if they are of that same variant. And those who are testing positive for this variant are being put under isolation. Apart from that, since the variant has also been found in other countries, almost all passengers returning from any international, any across the border, they are also being tested, and their samples are being sequenced, so as to make sure that even such variants coming from other countries can also be identified.
Right.
So those are the first few things. And also now that we have 6 samples here, so these samples will now be sort of cultured, in the sense that we'll produce more samples of that strain of virus, of that variant of virus, so that that can be sent to scientific groups who can now check whether our tests, whether our treatments, and whether our vaccines will work against this strain, and just understand in the lab exactly how this variant is different physiologically than the one that had been circulating so far.
Right. Mona, before we go any further, if you can just in very layperson words explain what this new variant is and why is it more worrying?
All right, so mutations are not actually news for anyone who understands basic science. Any life form will have some sort of mutation, because the process through which a life form copies itself, it copies the genetic code, and there are small errors or typos in that genetic code, which is basically a mutation.
Right.
Now, in this case, a lot of times these mutations don't actually translate into any physical changes in the organism, or in this case the virus. So, but what has happened here is that in this particular variant there are 23 mutations, and of these at least 8 are causing a small change in what is the spike protein. Now, why that is concerning is because all of our vaccines are aimed at the spike protein. The antibodies that these vaccines will produce attacks that. So that is what has gotten everyone worried. And
right.
The spike protein is what enables the virus to latch on to our cells. So in case there is a change in that spike protein, that is what is causing the increase in the transmission.
Right.
So basically the entry point is what has changed. So that is why this is of concern at this moment.
Okay. Now, from what I understand, the Indian government has said that there is no reason to worry, and that there's nothing to show that the existing treatment or the existing the vaccine candidates will not quite work on this variant. Right. So on what basis are we saying that?
Right. Let's get to treatments first. Most of the treatments that we are looking at are aimed at looking at the symptoms, basically. If you look at remdesivir, they are not exactly killing the virus itself. It's more about tackling the symptoms. So the virus is still going to attack your body pretty much the same way that it does. The variant does not change exactly what it causes in our body, what differences it causes in our body. So that is why the treatment is not something that will differ. So that is what the Health Ministry also said today. As for vaccine, again, these are like like I said, these are very small mutations that have caused changes in the, in like one amino acid of the protein, one building block of the protein, not changing the entire protein. So at this point, from what is being seen, there is no evidence to suggest that, we may need new vaccines for this. But having said that, we will need to continue this process of genome sequencing and ensure that no such variant comes up where our vaccine efficacy can be under question.
So is there any way to tell whether this is more contagious than the existing
right. So the UK actually they have actually done an analysis. First of all, there have been studies in animal models which is showing about 56% more transmissibility. So that is, but then whether this is translating into the population was something that was being questioned. Now what happened is UK did a mathematical epidemiological study which did show that this variant is becoming more dominant in the population. Even then there is always a question of it could be a matter of chance that a certain super spreader event caused a lot of infections, and that particular variant, it becomes more easily available, or its prevalence increases. But that does not seem to be the case, which is why the scientists are saying for sure that this is the transmissibility is increased in this
All
case.
right. Okay, so let's begin with this question from NH Rajendra. What is the status of the vaccine, and will it be able to cure this new strain as well? So the second part you've already answered.
Right.
What is the status of the vaccine? That's $1 million question.
So we are still under phase 3 trial. So unless we get those results, under any circumstances, we would have to wait for those studies to be properly looked at before before any vaccine can be rolled out. And having said that, the coronavirus vaccine has created history. It is one of the fastest vaccines to be made to be manufactured and to be rolled out. So I think we are moving at a good pace, and we should just be patient for now.
Okay. Dev Verma, the mutant COVID strain was found in the UK because of good screening systems. It may already be present in many other countries. Sorry, I've lost the question somewhere. Shouldn't we be checking every flight that lands within India to India?
Right. So, I would like to say something about this, that it is not that India has not been genome sequences. Before this happened, we already had a network of labs. CSIR has sequenced more than 5,000 samples in India, and we do have our own variants. We did a story just yesterday that India itself has some 19 variants that are showing, some evidence of it being able to escape our antibodies. So it's not that India is not screening. India is screening, and as for it being found in other countries, yes, it has been found in other countries. In fact, our story yesterday also said the same thing. And like I said, all the international flights, passengers from all the international flights right now are being tested, and their samples, any positive sample is being sent for sequencing as well. So it's not just UK flights have been banned and there is increased surveillance from those countries, but it is happening for all countries.
Well. Right. Okay. Harika Dronawali wanted to know whether this would affect the vaccination process. I think that's another question we've already answered. Anjan Rajan, tracing suboptimally, we have enough capacity for genome sequencing, but have sequenced only around 4K samples from March till November, which is 0.05% of all the positive cases, as compared to the UK, which has sequenced 1.6 lakh, which is 7% of the positive cases.
Correct. So we do have, compared to UK, we right now have 10 labs, and I was actually looking at the numbers, and based on what they have put out, it seems that we have somewhere between 23,000 to 25,000 sample processing capacity across the 10 labs. Now, some of the data was missing, so this is what I know for now. So definitely our sequencing is much slower, and in fact, right from the beginning of the first 2 samples back in March when they were sequenced, the scientists have been constantly talking about need to ramp up genome sequencing. It's a slightly more expensive, slightly tedious process. We do not have enough labs doing that for sure. But now that the government has, they have started a consortium. It's called the Indian SARS-CoV-2 Genomics Consortium. So this includes 10 labs, includes the Health Ministry, NIV, and also includes the NCDC. So we are hoping now that this care has come, it will increase. But again, I would reiterate that we were genome sequencing all
earlier
throughout the pandemic.
Right. Tanveer Panjwani, is this new variant of virus, does this behave differently in different countries? Why is the Indian government adopting a different approach to the new variant compared to other countries?
Right. So same thing, like because this one is dominant in UK, it has already shown to have more transmission rate. Now the thing is that it is not showing increased like it's not like it is causing more severe disease, but the point is if the transmission is more than before, we'll again have like a huge net of people who will come under the virus, and that will affect us, a lot more people. So that is the concern here.
So does it impact the R value also in that case?
Yeah, so again, this was another study which showed that yes, the R might increase by 0.4 or more, which may be concerning if, like, for India, we still have a huge number of more than 2 lakh people who are active cases. So in that case, like when we already have a large base, even a small point of difference can cause the wave to rise again. I mean, today we have some 16,000 cases, new cases, which is the lowest in 6 months. But we do not want to go back to that situation where our hospitals are overburdened and our crematoriums are filled.
Right. Then this is from Abhimanyu Puranik. Is there any change in protocol required for the handling of the new coronavirus, of the new variant as compared to the earlier variant? Are there new requirements in form of technology and resources that are needed by medical personnel?
No, so it is pretty much the same. I mean, the whole protocol designed around handling virus is standard. It is to make sure that that no matter how dangerous or how simple the virus is, there is no chance of it getting out of that system of that laboratory. So those remain the same. Which is another thing that we need to reiterate. It's that in new variant, old variant, our masking, social distancing and hand washing will still work against the virus. So overall the virus remains the same. So you need to you should take the same precautions to just make sure that you don't get infected. That is the basic thing that everyone needs to do.
Okay. Akshay Kumar, not the actor, I hope. Will there be any lockdown? I mean, is this alarming enough to warrant yet another lockdown, which to me seems like a very, very remote possibility now?
Yes, at this moment, from what we are hearing, there is no discussion of a lockdown, and I think India has already seen that the lockdown did not quite help. I mean, it just brought a lot of people back home. Like, we saw studies that showed that if you're locked in the same house, there was a higher chance of all the family members falling sick as opposed to people going out to work and getting outside and spending less time with their families back home. So lockdown is definitely not under discussion at this moment because I mean, like I said, they've found the 6 cases and they're isolating. But again, this is something that only, I suppose,
how things unravel,
that's when
later.
we will know.
All right. Vladimir Putin, Orissa government has not been able to trace 60 people who came from the UK. What to expect? So I think this is a larger problem where we may not even know about many passengers who've come in who are perhaps positive, who may be carrying this particular variant as well. So what is the surveillance approach?
Ruhi, if you remember that even when the first few cases started trickling down, in India back in March. We had cases from Delhi who had just sort of slipped out of the radar, and which is why we saw a spread, But again, we just need to hope that firstly, passengers themselves need to become a little more responsible, because as far as I know, most of the international passengers are asked to home isolate, right? So it is up to them in that case to make sure that they do home isolate and don't step out. So there is only certain things that authorities can do, but if people are actively trying to escape those methods, those surveillance methods, we will fail as as a country, because I think some of the onus of responsibility has to be with the travelers as well.
All right. Okay, I'll ask you two last questions. One is from our viewer Anjan Rajan, and the other one will be from me. Do we have a standard operating procedure as far as genome sequencing is concerned, especially for sequencing per total positive cases? Is there any WHO guideline on the same?
Right now, what the guidance is that all states now have to send 5% of their positive samples to these labs, to the 10 labs, and they will then report whatever results they get, and all of this data will be collected by the NCDC. So that's as far as protocol is concerned. And what was the other part?
No, the other question I'm going to ask you now.
Okay.
So, as we speak, the Health Ministry briefing is still on, or it may have just finished.
Yeah, it's just gone.
This is a weekly COVID briefing that the ministry does, and I'm sure today was entirely or largely around this new variant. So any highlights from that?
So the highlights were basically the government saying that we do not need to worry about the vaccine. It will still work, although in their release they have talked about actually studying it further to make sure that there is no effect on the vaccine. And the guidance remains the same in terms of making sure that your basic hygiene, basic social distancing and mask wearing, all of this should be maintained, because like I said, it's not going to affect it. I mean, it will work against the new variant as well. So just make sure that you continue doing that. And they also talked about the consortium. So there will be a ramping up of the genome sequencing, so we will know that what is the status in terms of, do we already have it in our population or not? And they also did talk about the fact that we already have certain variants of concern in India itself, and it is very expected for us to find a mutation. This was not something that came out of the blue. We were monitoring it. That is why it was found. So this is like a continuous process, and again, the
basic hygiene remains the same.
Yeah, just make sure that all those basic
do's
things are followed.
Right.
And just stay safe. And I mean, that's the most we can do at this point.
Right. Well, thank you, Mohana, for explaining this rather technical subject very lucidly. I realize you would make for a very good teacher. Thank you for sending in your questions. As Mohana has repeatedly said in this conversation, new variant or not, basic hygiene remains the same. Wear your masks. Step out only if absolutely necessary. Wash your hands. So follow this basic hygiene, and let's hope that things will look up in the new year.
You're right.
Well, thank you for watching Government Matters, for sending in your questions. Don't forget to subscribe to our YouTube channel for much more.